Um, I know what, I mean, she was just going to mainly listen in, and then you can try. Yeah, go ahead and try it.
Okay, but one moment, and then what I'll do is advance the slides as you'll see them there. I'm not sure what the problem is, but let me see if I can reach Kim by telephone. Paige, I'm going to give you the phone number that I have most readily available for Kim. If you could call, and then Keith can get started, and we'll go from there. So if you'd please call Kim Dews at 301-792-0831.
Okay, thank you.
Here, I'll IM it to you. I'll give you two numbers. I'm sorry.
Thank you.
I should have thought of IMing before. There you go. So, Keith?
Yes.
We're going to go ahead and try to reach Kim. You have about 71 people on the line, so let's not keep them waiting. I want to say thank you for putting together the webinar, and thank you for taking the time with the state offices to answer questions. Folks, the call will be recorded. It will be posted on our website along with the slides, so like you do with all of our webinars, you can go right to our website for the recording and the slides. Keith will also have a template that we'll share and post on the website. In addition, SORH will be sending you a little sample budget justification for a couple of items that we know are important for you to include and things that you might want to consider related to SORH services. That's not a commercial announcement, just a advisement that we'll be sharing that with you. Also, as you're writing on your grant applications, we're happy to support and help you with those. So let us know well in advance if you can, if you need a little insight of those. So Keith, again, thanks once again. I'm sorry you had some technical difficulties there, but I think you can begin, and I'm going to try to keep up with you on flipping your slides. So you can just say next slide when you're moving on if you'd like.
We'll go from the first slide to the next slide. Well, good afternoon, everybody, and thank you for taking the time to participate in this webinar. I know there's a few state offices, some folks that are already out for the holidays, but hopefully they'll be able to get this information, or somebody else from the office is sitting in. I apologize for the confusion with the webinar technology. We're having a little problem here at HRSA, so I am looking at my screen, and Terrell's going to try and keep up with me. I have got the guidance in front of me, the FOA, and I'm going to kind of start by going through it. But first off, just a little overview of what I'm going to cover here today. I'm going to give you a little background on the FY16. We're going to talk a lot about the project narrative and the methodology section, the evaluation and technical support capacity section, a little bit about PIMS that is new. We're going to talk a little bit about the budget, staffing, indirect costs, the various attachments, technical assistance that's available, and then we'll take any questions at the end, or you can send any of those questions to the Terrell or myself if we don't have time or you don't have time to stay on the call. Let's go to the next slide, please. FY16 is the 26th year of the SORH grant. Can you believe that? Wow. It is a competing continuation FOA, and it was released on November 9th. It did come out a little bit early, which was good. There is a link there that it came out via grants.gov. Since this is a competing continuation, different than a non-competing, the application is sent through grants.gov, not through the EHB. And this is very important because you have to be registered and utilizing grants.gov. Most of you are already in EHB. I know we've got a few new folks out there. So you will have to register in grants.gov. And it walks you through that process. The application is due in grants.gov January 15th, 2016. That is a Friday. I looked up today. Please, 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 I cannot emphasize enough. Do not wait till Friday the 16th or Thursday the 14th to put this in. If there is a glitch in grants.gov, it could be very problematic. They are really tightening up, even though this is a competing continuation. It's been going on for a long time with other grants. If they're not in, and they don't get funded. So I cannot impress upon you enough. Please don't wait to the very end. The other thing I want to please emphasize is that please, before the deadline, double check your page count. print it out, because the numbers that you will see internally or in your document may be different. Now, 80 pages is still a lot. Nobody should even be close to that. But if you go over that, again, it's very problematic because it's technically, it's deemed insufficient. So those two things I think I've emphasized enough there, as you can see on the slides there. The good news is this is going to be a 5-year project period versus a 3, which means the next 4 years are going to be non-competing continuations. Much easier process than this much more detailed and complex one, although not overly complex or different from the one we had 3 years ago, the FY16 one. This year, the minimum that you can request is $150,000, and the maximum that you can request is $172,000, and that's based on what the awards have been and what the anticipated appropriation is going to be. If suddenly, again, we have no budget right now, this is still basically a ballpark, but you've all seen the award come down slightly over the last few years because the appropriation went down a little bit, and we've also cleaned up the UOB carryover, which was indirectly, to some degree, subsidizing some of the higher awards. Let's go to the next slide, please. So I am looking at my FOA, and I'm going to jump forward here. We've kind of skipped over the first several pages, and I'm going to work my way up to page 3, where we start talking about the actual application. It mentions there that there's an abstract, and then it starts talking about the narrative. The narrative format is really unchanged from the last time. There are multiple sections. You can see them listed there: introduction, needs assessment, methodology. All the sections in the narrative must be in a narrative format also, and that means not a bullet format, but an actual narrative format in your style of writing, except for the work plan. The work plan is to be in a matrix or spreadsheet type orientation, and it should be a landscape document versus the other documents. The narrative should be regular portrait orientation in a narrative style, and then the work plan would be in a landscape style in a matrix or spreadsheet format, not in a said previously a written narrative format. The methodology and the work plan objectives and activities must be identically numbered. And Carol, I updated a sample. It's not, but if you're looking at what a matrix spreadsheet work plan should look like, she's going to post a sample there, and you will see how it's been numbered. And so the work plan numbering should be identical to the numbering in the methodology section. They should be in alignment with each other. Remember, the work plan is the framework for the methodology section. The work plan says, here's the activity that I'm going to do, and the methodology section talks about the details of that particular activity. They complement each other. Methodology section provides the detail about the concise objectives and activities that are listed in the work plan. The methodology section, both sections pertain only to activities funded by federal and state matching funds. Please do not list PCO activities. The last couple go-arounds, a lot of folks, I know some of you are dual-hatted, you're also the PCO, and you kind of get, they overlap in some areas, and so we see stuff about HIPSs and things like that that are listed as activities that you're doing or designations. So please make sure that you're not listing any PCO activities. And I'll talk about this a little later on some more, but hey, Carol, could somebody put that line on mute? A couple maybe aren't muted there.
A reminder to please mute your line. If you don't have a mute function on your phone, try *6, please. Here's some clicking and some clacking and some talking and some rearranging, so give that a shot. Thank you.
All right, so the last bullet at the bottom here says it is optional to summarize in the methodology section, only in the methodology section, any activities administered within the SORH framework with other leveraged funds. What we're saying here is, and making it easier for you, what we wanted to hear from you is the activities that you are doing that are required to do by the grant, and that includes being funded by the federal dollars and your match. Now, many of you, especially the larger offices, have got many other activities going on, especially some of the not-for-profits, and that's all great, and you've been able to leverage a lot of funds, but you do not have to describe any of those activities. However, if you want to put it in because in the review process or internally you want to promote some of the activities that you're doing within your review process, fine. Go ahead and list any of those you want in the methodology section of the narrative. You do not need to list any of those activities that you do with other funds in the work plan. The work plan is exclusively to talk about the activities you do for the 3 core areas of this grant program, and we'll talk about those a little more, and with the funding that you receive via the federal dollars and your state dollars. So that is a little bit of a change from previous years. We can go to the next slide there. So mine just got moved here. Hold on. Okay, so now we're going to talk a little bit about, specifically, we're going to, oops. Okay, there we go. I'm now to continue talking about the project narrative. And like I said, there is a focus on the 3 core objectives: dissemination of information, coordination of activities, and providing technical assistance. Also remember, under dissemination, one of the required activities is to promote what we did say was the RAC, but as of last week here, promoting of the RHI Hub, the new name for the RAC, and the Rural Health Research Gateway. That is one of the required activities. Recruiting and retention is still part of core area 2. Again, there are states that do the minimum of supporting rural recruiting and retention by participating in an organization like 3RNet. However, there are several states out there that have significant investments in recruiting and retention beyond that minimal requirement. So for those SORHs that have a significant one, they can discuss that as a separate core area. You can call it core area 4, but again, that's an option for them. And again, this goes back to if it's beneficial for you and your processes and internal processes to really lay out all those things, all that extra effort, you can lay it out separately. If not, you can just fold it in and talk about it as part of your core area 2. So you may, at the bottom of that next slide, required and optional activities for each core area are listed in the work plan, and we'll talk about those in the methodology section. So I'm at the bottom of page 4 of the FOA. So we're going to talk a little bit here about core area 3 because there's a little bit of a change from the other years. Core area 1 is still the same, just collect and disseminate information, and I mentioned the one activity there for the gateway. 2 is coordinate activities in the state to avoid redundancy. And number 3 is to provide technical assistance to public and nonprofit private entities. You can read the rest of it there. And what we want to do this year in this section is discuss the various types of TA that you intend to provide, as well as the type of clients that you intend to provide that to. This is not meant to be duplicate of your PMS reporting, but you can look back at your PMS reports and see what you did last year. And looking at, again, since TA is the one measure that we report as part of the PIMS, we want to collect a little more information about it. So just basically looking here for you to make a statement to the effect that possibly you've increased the amount of TA you've provided via webinars. You are providing more TA to critical access hospitals than you have in the past. So just some more detailed information about both the type of TA that you're providing and the people that are getting it. I'm going to go on to the evaluation technical support capacity. And this is where we describe the strategies and measures that will be used to evaluate performance. And this is an area that across the board in all of our grant programs been working to strengthen. As you all know, we're being more and more scrutinized and asked to evaluate the value and the impact of our programs. So again, there's some information here, more detail in the guidance about how to fill out this area, but basically describe the strategies and measures that will be used to evaluate performance, describe the data collection strategy that will be implemented. Some of you are using TrueServe, and Terrell's going to talk briefly about that at the end here. And again, this links back to what I mentioned earlier, is to describe your most recent PIM submission. And you can just copy those numbers right out of the your last report and discuss any changes that have occurred that you've been seeing and what you anticipate in the current year. You've actually got a year going on now. You know what you had in FY14. You know there's some stuff going on in 15, and you're projecting out into 16. So we're just looking at trends here, but some of you do a lot of clients, are all over the state, and some states interact with very few clients. So we want you to talk about that effort, because this is one of the key elements of the grant, is providing technical assistance. We'll go to the next slide. All right, we're going to talk about the budget. Now, what is different than previous years is you will notice there is no other budget information in here. However, you will see a link here in the slide, and you'll see it in the FOA, that takes you to a HRSA document that will walk you through the budget application process. It really, though, is not significantly different than other years. I mentioned here that the budget and the budget justification narrative differentiate between the federal and the matching funds. There should be two columns, actually three columns. You have your federal, your state matching, and then your total. We do see on some years where folks do not break out the budget. They lump it all together, the state and the federal. So the SF424 has a number of columns there to allow the breakout of both matching and federal funds, and then the total. Travel estimates, pretty much the same, must be itemized. In other words, you just can't say, I want $1,000 to go to NRHA meeting. You need to break out, and these can be estimates. Basically, it falls into airfare, lodging, per diem, miscellaneous things like, parking, and then also any mileage, rental car, things like that. Contracts, nothing new here. It's just that you must include the basis for the cost estimate. If you say you want to do $10,000 to do some kind of trainings or whatever, you need to show the calculus behind where that number, how many trainings at how much cost to how many people or how many times. The budget is for 3 required meetings. I got the dates here from NRHA. So the 3 required meetings are the regional partnership meeting, and the sites will be determined soon. And Terrell and I are working on those. We do know for most regions what city it's going to be in, but we don't know the date. So as soon as we get those dates, and we'll pass those out via regional calls. The NOSOR meeting annual will be in Boston in 2016, and since this grant goes into the summer of 2017, it would include the NRHA annual membership meeting, which in 2017 will be in New Orleans. You may also fund other travel, such as travel to the NRHA Policy Institute, NRHA Critical Access Hospital, quality meetings, but those are all to be, internally for you to decide based on your priorities what you want to go toward, as well as any of your local travel. Next slide. A little bit about indirect costs. Not a lot of change here, but states may charge indirect up to the maximum that they're allowed by their current agreement. There is no 15% cap anymore. So if you have a rate that allows you to claim an amount that exceeds 15% of the award, you are allowed to take that entire charge. Most indirect charges are usually a % of salary and fringe. States are not required to charge the indirect. There are some SORHs, both university and health department models, that have actually waived or reduced the indirect costs so that they can have more funds for their rural programs. If a state decides to do that, that waived or reduced amount can be used toward your match. So it's called an unclaimed indirect. So I know there's one state out there that's a university model that when the cap went away, the university continued to just stay at 15%, but what they were allowed to take above and beyond, they now claim as part of the match. There's another university model out there that claims no indirect, allowing all the funds to go. So there's a wide variety out there. What we are seeing, though, as each state, or as some states renegotiate their indirect rates, they never seem to be going down. They seem to be going up. One other thing that we've noticed that some states are claiming rent and technology fees as direct costs, and that's fine as long as those are not included in the indirect cost agreement, because the indirect is supposed to capture those elements that cannot be directly costed out, and that usually means, you know, lighting, heating, building, security, things like that are all kind of rolled in to an indirect cost. So if you are going to claim rent or anything specific like that, make sure it is not in your indirect cost agreement, or we'll have to have it checked on this end, and then you might see, you know, it taken out, and now you got to rebudget and everything. So just make sure that the direct costs that you are claiming are not in any way related to your indirects. The next slide is on staffing. The staffing plan must include position descriptions, amount of FTE, and resumes for all key personnel. And key personnel are considered to be those funded by the grant. There is a section in the FOA on page 11 where there's a little bit of expansion about the need to have a SORH director. A position title may vary, to be the dedicated face of the SORH. It goes on to say that SORH funds are not intended to fund organizational positions whose primary purpose is not directly related to the completion of SORH objectives and activities. Recipients are expected to have the organizational capacity to provide necessary administrative and financial support to the SORH. Now, that does not mean you can't have some, administrative support there, but as far as where it gets problematic is positions that are exclusively dedicated to budget and contracting, where there is a significant amount of effort being claimed against these grants. So if you have any, I've had some questions on this already. I'll deal with those individually, but this is a new change, and there's a reason for that because of a few states where there are a number of folks listed that really are not related to have anything to do with completing the activities or any of the objectives of the grant. So, and this is no different than any other federal grant. By virtue of asking for a federal grant, you're saying I have an infrastructure here in place and I want this grant to do certain things, and I will hire people with the necessary expertise to do things related to the grant, but I already have the infrastructure in place. And in most of your organizations, you've got multiple, federal grants from other entities, HRSA and others. So again, if you have any other specific questions, and again, this really was inserted not because it was a huge across-the-board problem, but there were a few states where this needed to be clarified. Next slide. Okay, we're going to talk now about all the different attachments that are the grant. The work plan is an attachment. It is, again, like I mentioned earlier, it's numbered and in alignment with the methodology. The staffing plan and position descriptions, the biographical sketches or bios, letters of agreement, or descriptions of proposed existing contracts. And you'll see this language in there. It is boilerplate as far as the template goes. I had a call even today saying, do I need to attach letters of agreement? And the answer is no. There's, unlike other types of grants where letters of agreement or can add weight to your application, it is not actually required, but it is allowed also. As far as existing contracts, what that means is if you have a very large, ongoing, extensive contract with an organization that's doing some of the work for you, it would be appropriate to have a letter from that organization showing that they are going to be doing this kind of work. But this is again, only would apply to a couple of SORHs. Most of your contracts are more service-related contracts than actual more infrastructure-related. Need to include an organizational chart that includes the SORH somewhere showing them where it fits within the organization. A multi-year budget. Because this is a 5-year grant, we have to put in a 5-year budget. Now, the the SF424 only allows it to go up to 4 years, so you'll need to attach another 5th year SF424A, and that just lists the real basics. It just lists the salaries, travel, contracts, et cetera. Now, it's up to you. Some of you, as you look forward over the next few years, you may anticipate some higher salary costs, so you can list, slightly different costs in your out years. If you choose to think that they're going to pretty much be similar, you can just list the same amount as you're listing for what you're requesting for FY16. You're not bound by those. Again, there will be variations and rebudgeting that'll occur based on the awards in the out years. But if there was any significant changes that you're looking, like you're going to expand, you're going to hire another person in the next year or something, you'd obviously want to list a higher salary amount. Again, we know that with inflation, everything costs more, travel costs more, and unfortunately, you're not getting any more. But again, remember, this budget includes your state matching funds also. So it is a 5-year budget, but I don't anticipate any of you are going to have really significant difference there. So again, you only have to do the budget justification narrative for the year you're applying for, which is FY16. You don't need to put 5 budget justifications in there. And the SF has areas to list the out years, the totals of what you're going to be, X was or any of the other ones.
Keith, one moment. Paige, would you try to figure out who put us on hold and did not mute their line and try to mute their line out, if you could, please? Somebody put us on hold and did not mute their line, so we're going to try to find who that is. Bye for a second. I'm so sorry. I have a couple of questions for you. We'll try to get, and if not, we'll send out the answers afterwards. So, do key personnel need to include graduate students who are funded as wage payroll employees for 20 hours per week? Keith, are you there?
Could you repeat the first part of the question?
Yeah. Hang on just a second. Let me. So what person wants to know, and thanks for the question, is do key personnel include graduate students who are funded as wage payroll employees for 20 hours per week?
If they're paid out of the grant funds, either the federal funds or they're being claimed as the match, they would be listed as a key personnel.
Thank you. And then where do they include their organization's indirect cost rate agreement?
Okay. That is not listed as there is. The new template from HRSA does not include that as a required attachment. The reason is they have it online now. I mean, they can look at it. It could certainly be attached, but there is no requirement per the template that it be attached.
Okay. Then the next question is, do we need to submit bios for staff funded by state matching funds?
Yes. Remember, there's no differentiation between SORH funds that are federal and SORH funds that are state matching. They're all one big budget. So we're not, even though they come from different pots, they all are the grant. So anything that's funded out of staffing-wise, out of either the state matching or the federal, which like I said, I look at them as all personnel funds, then yes, they should be listed.
Okay, one more, or two more, at least two more. Does the 4-year SF424A count towards the page count?
I do not believe it does. It's in the guidance there. It talks about it in that. Like I said, there was that link to the. But I think it does not count towards it.
Okay.
make a note of that. I'll make a note here, and we'll double check on that. It mentions in that attachment there, or that link, what budget forms are and which are not included.
And then last question that I'm seeing up on the screen for right now is, what is the allowable maximum budget amount for the years 2 through 5 budget?
It would continue to be 172.
Okay. All right. Keep using that chat feature, folks. And I think we're about to talk about the accomplishment summary.
Yeah, and that's not new. We had that last year, and that and the PIM stuff. The reason for both of those is to not be doing what we used to have to do, which was where we're essentially putting in a progress report about a prior project period at the same time. And if you recall, years ago, we used to have to put in 2 work plans, the current one and the future one. So that accomplishment summary kind of fills the gap of sufficing as essentially a progress report. And again, it is a part of the template. It's not just for this grant. Any HRSA grant, Flex SHIP, are going to have that same requirement there. So it talks about it. It does not need to be a work plan attached to that. It's supposed to be, looking at page 12, it should be exclusively in a narrative form. There are 5 components of it. The period covered, which there's the dates there, which is the ongoing year, and basically where you're at this point in the project period, any challenges for the remaining of the period. This is also an area where you can discuss. Right now, we're just dealing with the UOB, and we're almost everyone's, except for a handful of states, have not been finalized yet. So this is where you would mention in there that you had a UOB of X. You've requested to be carried over. You want to do more of this or that, or you've elected not to carry over your UOB. So you would talk about that. So it's not a lot of information there, but in an ORC scoring thing, if it is not there, it'll impact the amount of points that you get. So that's why it is important.
A follow-up question regarding the attachments for staffing. If a state match comes from other state agencies supporting the SOAR grant activities, are you really looking for bios for those as well?
I'm sorry.
I'll read it as it was typed. If the state match comes from other state agencies supporting SOAR grant activities, will bios be required?
Well, I mean, that's a little confusing, so that person might want to contact me directly later. But as I stated, if the match dollars are funding positions, regardless of where those match dollars are coming from, then yes. I think now, what I'm hearing possibly, I know we've got some SOARs that, let's just say the match comes from the state loan repayment, okay? So the person that oversees the state loan repayment would not need to have their bio, okay? So we do have a number of SOARs where they fully manage the match, and the match is an integral part of their the budget that they operate, versus there are some matches we know where the funding for the match is totally not really managed by the SOAR. So in those cases where the SOAR director is not in any way overseeing those funds, and if there are people related to that program, no, they would not need to be recorded. So that state can contact me directly if that still wasn't clear.
Thank you. Flip to the next slide on technical assistance.
Yeah, I want to mention here that, just want to get mine done, that we have a lot of new folks working on the program now. I want to welcome this year. We've got Cassie, who will be helping Terrell as far as any questions and follow-up. We've got other SOARs. Many of you have helped each other over the years. We've got your FORHP project officer, which actually, as of December 1st, will be either myself or Suzanne Stack, and we will be your project officer. We have two new grants management specialists. Kimberly Dews has been with working on some of the rural grants, including the NOSOR Cooperative Agreement for some time, but Pody Petway and James Paget are the other two. And one of those three will be listed on the bottom of your NOA, just like these three names are on the bottom of your current FY16 NOA. So we are all here. If you have a specific budget-related question, then it should go to the grants management specialist. More program-related ones should come to me. But again, you can copy each of us on each of the questions, and that way we can work it as a team.
So there was a comment on the chat that said that they were informed at NRHA that the 2017 annual conference is in San Diego, and the room rate is $209 per night with a 12.695% tax rate. And we'll include that in that little follow-up budget.
So did that person confirm, is it the next year that it's going to New Orleans then? Is that what I heard?
It was for 2017 that Mary shared. So you gave information on 2016.
Okay. No, I think I mentioned New Orleans, and what you're saying is that it is going to be in San Diego, not New Orleans.
No, I said for 2017 it's in San Diego in May. You gave 2016 information, I believe.
Okay. Good. Well, thank you for that correction, because
I'll double check, and we'll make sure that it's correct in the handout. I don't think you said anything wrong, or that the 2017, I'm not sure how that impacts budget.
It's the budget, and obviously some of their locations have a higher per diem rate than others, and I would assume San Diego would be higher than possibly New Orleans would have been.
Yep.
So, and you were going to talk about TrueServe and some other things. Is there any more questions? Chat line there.
So I don't see anything else on the chat line. Let me double check one more time. I'm sorry. And someone else is saying NRHA 2016 is in Minneapolis, so we'll double check that. Can you, a question for clarification to explain core area 2 more and the type of coordination that is expected of state programs?
All right, say that one more time.
Can you explain core area number 2, the coordination, and talk about the expectations for state programs around coordination?
Okay, yes, all right. I'm on looking at bottom of page 7 where it talks about that. And that is a very broad objective of the grant. And that is why we only include a couple of required activities for that area, and those are, I'm looking for those, and that's essentially, coordination essentially means to be at the table. I say it means to participate in various meetings, councils, having the SORH have available, working with stakeholders, and that says here, participate in or attend select community, regional, or statewide committees, boards, councils, webinars, conference calls, and venues for the purpose to engage in issues and activities that impact rural health in communities. Attend and participate meetings and events offered by national level partners. So, again, attending the NRHA annual meeting, attending the annual NOSOR meeting, those are activities that fall under that area. There are a number of other examples here that some folks may do under the optional. I've listed about 10 different ones that some SORHs do, but the minimum is to participate in the meetings, to support the multi-state, to also include the recruiting and retention. But again, on page 8, there's a number of other things that many states do, but it's not a requirement. The 3 that required activities are broad, and in most cases, states are going to list in their work plan other activities, sub-activities to these kind of somewhat broad activities. And again, the overall, if you read the legislation, the purpose of a coordination was hopefully to avoid duplication of effort. So, and that's another reason for the SORHs, is so that they are aware of what's going on in their state. They're at the table. You know, someone's starting something recruiting-wise, and you say, well, hey, do you know about 3RNet? We're already working on this. Or someone wants to start some other new initiative that hopefully, because of all the contacts and all the information that the SORH has, that they'll be able to work with these other organizations in partnerships, collaborations, and avoid duplication, so that these limited resources that are out there, you know, have the best bang for the buck.
Okay, and then another question from the chat is, does the SORH director's salary and fringe have to be funded through the SORH grant?
It has to be, well, yes, in one way or the other. It has to be either from the matching dollars or from the match, or well, I take it back. A state could pay the SORH director, okay, out of state funds, and then the state funds that they use for match or are used for other things, and the federal dollars are used for other things. So yes, I mean, what you can't have is a situation where the SORH director is being paid 50% by the PCO and 50% by Flex, and then they're listed as the SORH director. Okay, that would not work. Okay, but yeah, I am aware of one state out there where or maybe that's not a full FTE, but a portion of the salary is basically gratis from the states above and beyond the match.
Thank you. Sorry, had to have to mute people so that they couldn't ask their own questions. So, believe that is all. There's a question to please explain why the cap was removed. For states with a higher rate, this really hurts our programming dollars.
We had no control over that. Unfortunately, it was never in the legislation. The Flex legislation does actually have a cap that says that the indirect cannot exceed 50% of the award. So back the last FOA, when this went through legal review, it was determined that it was not within the statute for us to cap it, so it had to be removed. And we realized this had a significant impact, especially on the university models, which historically had or would have had rates that clearly would have exceeded 15% of the grant award. So again, it was something we had no control over. And when the SORH were to be reappropriated, reauthorized, language certainly could be included in that. And again, there are other grant programs where those caps are in there, and sometimes they're not. But when this was created 26, 7 years ago, it wasn't in there, but it was just surreptitiously inserted in there, and it flew along for 20-some years, but unfortunately it stopped 3 years ago.
Here's a couple more. Regarding the work plan, is the expectation that we include the required activities under each objective as they are stated in the guidance verbatim? Correct.
I mean, well, yeah, those are. You could reword them slightly, but those are requirements. Those three should be listed or must be listed on the work plan. Now, some of them may have multiple sub-activities to them, but at a minimum, if you absolutely were the most bare bones SORH and did nothing, else, would need to show that what you do under each of those three core areas, those three core objectives, and then the three required activities for core area 1, 3 for 2, and then the one under technical assistance.
Okay. And how do we report projected accomplishments for the remainder of the current fiscal year 15 year?
The only place to do that would be in the accomplishment summary. You would just mention your projections. Is it related? Is that question related to the accomplishment summary?
I believe so.
Okay. Well, or I think what they're saying is, the work plan is your future work plan is what you're submitting that is going to begin on July 1st, 2016. And again, that template that we'll be sending out, or sample template, shows what the expectations are, what the outcomes So you would just, obviously these are anticipated, they're your goals, but whether you reach them or not, you won't know until the end of that grant period. The accomplishment summary is really the same way, because right now you're still in that grant period, so you're just making a projection of, you're going to complete this activity, prior to the end of this budget period, or possibly this is going to extend, it's a long-going project or an initiative that's going to continue on into the next grant period. And that's where those kind of things are discussed in the narrative, in the methodology component of the narrative. So the activities are listed, in the work plan, and then the detail behind those activities, which would include your anticipated outcomes, would be in the methodology section.
Follow-up note about the accomplishments section. Could you be specific about the dates to be covered in the accomplishments section?
Yeah. Fortunately, it's only for it says, let me just back up here to page 12 here. The accomplished summary it is also mentions calling a progress report as a brief presentation of the accomplishments in relation to the objectives of the program during the current FY16 budget period. So that's the period that we're in right now, which you're only, essentially, by the time you write this in January, just over or halfway through your grant period.
So you're saying that when they write their accomplishment summary, they should write about accomplishments that they have accomplished and those that they expect to accomplish between July 1 of 2015 through June the 30th of 2016?
Correct. It's not for the whole 3-year project period that we just had. It's actually for the current budget period that they're in right now.
Okay.
And this comes from template language, which would basically tell an ORC reviewer, they'd see this and they'd say, oh, well, they're doing great stuff now, they're working on it, yeah, and they want to do the same stuff into the next year. It's to show that continuation of, refunding a grantee into another period of work. You would not have an accomplishment summary in someone who was applying, let's just say, for an initial outreach grant, something like that. So I realize that it sounds a little, duplicative, but it's required to be in there. So, but again, it's not a huge area, and it doesn't require a work plan. Just some narrative language for each of these 5 categories.
Okay. And then let's see, one more about that page limit and the 424. Since it is likely that the 4-year SF 424A is not included in the page count, is the 5th year 424A included in the page count?
Well, and that just would be one page. I mean, that's weird that they would count the one and not the other. Again, I don't have the grants management specialist on the phone here, but we'll make a note to follow up here with her. And again, there's 80 pages. I cannot even imagine one being close to that. It's I understand. The key is that make sure that when it's printed out, when you print it out, it's okay if you print it out an 85-page one, as long as 5 of them are the ones that don't count towards the limit. So it can be over 80 pages. It's just that those that are and somehow grants.gov, when we receive them, it'll tell us how many pages count towards the application. So we want that to be no more than 80. But I just can't imagine having one that long. Flex, yes. Okay. SORH, no.
Okay. I'm going to check the chat again. I don't see much else in there. Anything else in there? And I don't know if Kim Jews is on. I'm looking for her on the participant list to unmute her in case she wanted to chime in, but I don't see her. She must not have connected by the webinar, so I can't unmute her. Kim, if you're on and can unmute yourself, if you've muted yourself, then unmute yourself and you can talk if you'd like.
Hey, Terrell, it's Matt.
Hi, Matt.
Did you see the question about the cap? I can't remember if you addressed it or not.
Yes, we talked about the history of that 3 years ago and how we have no control over that.
Okay.
So the last one was, does the 10% grant funds related to research statement, page 14, pertain to federal funds or include the match also?
According to what it is specifically talking about the federal funds, at no more than 10% of the federal funds. It does not address the state funds. So,
okay.
Yep.
Okay, let's see. Matt, do you see any other questions in the chat?
You got the page count one from Lisa. Did you see Pat's question?
Yep, we answered Pat's. Yep.
Then I'm making sure that none came to the host only.
Okay.
Let me check. You got the question from Ernie?
Yep.
And anybody that has a specific one that they don't want to present at this time, again, can email me directly.
We had them on mute to keep the recording quality.
Okay.
That's all. So I believe that everyone knows how to find Keith Midbury if you need to ask him a question. I think it'll be interesting to see this year as you're focused on these, have the project officers engaged on this, Keith. At the end, as we're closing up the webinar, you all will receive a Survey Monkey that we'd like you to respond to. It helps keep our evaluation going. And certainly feel free to type a question in there and we'll catch it in the follow-up as well. Anything else, Keith?
No, I just want to wish everybody a happy Thanksgiving and thank you for taking the time. And sorry for the dates that so close to the holidays, but hopefully it'll be relatively easy. There again, there are not many significant changes for those that have done this in the past, but I realize that there are some new folks out there that this may be the first one. And I just want to emphasize that hopefully that when your product has value at your end also, and for your supervisors internally, that they can see what you do with this grant and what you do with the what a huge impact your state matching dollars have also.
Thank you.
All right. Again, y'all have a nice afternoon and a pleasant holiday. And if you have any questions, please contact me.
Thank you, Keith.